Dr. Christ and I are accessible every day. We're communicating what the situation is in Arizona, what the facts are, and what is necessary. With all that said, the fear that's out there is very real. I think you've heard from federal authorities, Health and Human Services, and I want to say it from the podium as well. The supply chain for Arizona and for the United States of America will be protected. We are in coordination and communication with the leaders of our largest grocery chains, and they will be replenished. So I would encourage people to buy what they need so that their neighbor can have toilet paper and necessary things for their food pantry as well. It was Dr. Christ that mentioned the situation of prescription drugs for someone with underlying health conditions. That would be maybe one situation where someone would stock up. In these other situations, I have high confidence in our grocery stores, in our manufacturers, that they will be able to more than keep up, but we've got to buy on a consistent basis.
What we're recommending on right now with the guidance that was released yesterday is mass gatherings over 50 people. So that would include potentially malls, festivals, parades, concerts, those types of things. As we're looking into what the CDC recommended today, we'll be making more tweaking to that guidance to identify, are there ways to social distance in restaurants? Italy had some interesting social distancing there. So how do we establish that? But we're still looking at that guidance. We are working with our healthcare partners to expand potential bed availability and looking at the ICU capacity around the state. With the declaration, the national emergency declaration issued by President Trump, that opens up certain authorities in addition to the public health declaration of emergency that Governor Ducey, that allows us to waive specific licensing rules so that we can increase capacity and ensure that we can get patients into alternate sites as needed.